Okay, let's talk about female reproductive cancers. We did talk very briefly about cervical cancer and endometrial/uterine cancer. And ovarian cancer, I think it's actually a little more complex. I think we won't cover that, but know that exists. But let's talk about breast cancer. So this is why we talk so much about the mammary glands. And this is actually why I got into science. So the thing is that breast cancer, what is involved? Well, obviously the breast. So remember that you have ducts and lobules. The thing is that breast cancer, like two major types or categories or that help to classify breast cancer, you have ductal breast cancer. So remember you have all those ducts. So if one of those cancer cells end up becoming cancerous and the tumor develops in ducts, this is what we call ductal breast cancer. There's also lobular breast cancer. Hey, where do you think that develops? That develops in the lobules. So again, those lobules where you produce all those alveolar cells and make milk. Well, if one of these goes rogue, becomes cancerous, then it starts developing the lobule. That's what we call lobular breast cancer. But it doesn't stop there in categorization. So in terms of classic breast cancer, you have ductal and lobular, but you also have in situ versus invasive. And again, invasive sounds like it is. It's invasive, it's not respecting boundaries, sounds more serious, right? In situ might be new to you. So in situ is a Latin term meaning in position or in place. So this is a cancer that's staying in place. And an invasive breast cancer, that means it's starting to invade the surrounding areas and starting to travel. So just like an invader, it goes beyond its original home and starts invading surrounding areas. So if you want to choose between in situ and invasive cancer, you want in situ because again, it's not spreading to the other tissues. So in situ, here we have an in situ lobular cancer. It's staying in place. But if this cancer and tumor can develop, it can start to gain properties that allow it to invade to surrounding areas. So again, cancers typically start out in situ, but left alone and long enough, they can become invasive and start invading the surrounding tissue. So what we see here is no longer in that original lobule. Now it's spreading to the surrounding areas, and it can actually end up back in your circulation and invading other tissues beyond the breast. Now, the major types of breast cancer, so as you can see, ductal and lobular and in situ invasive are, so again, you have, if it starts in the duct and stays in place, it's a ductal carcinoma in situ. If it starts in the lobule and stays in place, it's lobular carcinoma in situ. And again, it depends on the origin. Ductal, if it starts in the ducts and starts moving, it's invasive. And if it starts in the lobules and starts spreading to the surrounding tissue, it's invasive lobular carcinoma. Now, is that the only types? There's also inflammatory breast cancer. So inflammatory breast cancer is not so much like talking about ducts and lobules. Inflammation is a key distinguisher between this and the other classic four categories. And it's actually still being researched, but why is it so important? Well, the thing is that it's very aggressive. Compared to those other four categories, these are the ones that these develop way much more faster. Again, they can actually develop within weeks and often deadly because they're so aggressive. These tumors grow really rapidly. The weird thing about inflammation, or actually the kind of tricky thing about it, inflammation is actually promoting, when you have inflammation in an area, it does promote the immune response, but also promotes repair of the tissue after the immune response or during the immune response. So when you have inflammation in this case, inflammation is often tightly linked to growth of tissues and cells. So when you have inflammation in the tumor, tumors often take advantage of all the chemicals and hormones and proteins released during inflammation, and they take it kind of like a license to grow even faster and take advantage of the growth promoting factors released during inflammation. And this is why detection is critical. So what we see here is like not just about the internal, you can't see the lobules from the surface, but you can see the overall shape of the breast and nipples and areola. So what we see here is compared to the normal, what we have is like maybe itching, pain, redness, scaliness of the areola, and yeah, involution of the nipple. It's actually going, instead of being outy, is now it's inning. It's actually going inside. And discharge, again, if you're not pregnant or if it's off color or you have a discharge when something shouldn't be discharging, then that might be a sign of breast cancer. And I thought this was really clever too. This is, I think, knowyourlemons.com. But what they have here, any changes. So this is why breast exams are often very important. And so what happens is that we have like all this different, like actually indentation, crusting, inflammation, fluids that's unusual, orange peel skin. So actually the skin can change in texture. Actually, I think it was actually discovered by a French physician. So they call it peau d'orange. And this is what it means. The texture looks like an orange peel. But as you can see, if your nipples are usually pointing outwards and all of a sudden they're inwards, that could be a sign. Or actually, I had a friend. She has breast implants, but the thing is that she actually survived breast cancer. And the way she found out is I think she was watching a reality show. And on that reality show, I think it was called Botched. But actually, a woman had breast implants, but she also had breast cancer, but she didn't know. The way she found out is that her implant actually did a 180 and flipped around in her breasts due to the breast cancer. And that happened to my friend as well. So it's also why breast exams are very important. You have to know what your normal is so that if something is abnormal, you're like, hey, this is a lump that's not usually there. Is it breast cancer? The good thing is it's kind of like testicular cancer. It's probably not breast cancer. Actually, if you remember my mom from last year's or last semester, so she actually had a breast cancer scare. And good thing is that she found a lump, but that it wasn't a breast cancer. It was actually a fibroadenoma, which is sounds like a tumor, but it's actually just a growth. But it's actually not. It's benign. It won't develop. It rarely develops into breast cancer. But she was also checking because her sister actually is a breast cancer survivor, and her cousin is also a breast cancer survivor. And this is why detection is critical. And this is also why the part of the breast exam is not only feeling the breast itself, but say you have this tumor growing, so now it's no longer being in situ and now it's being invasive. Thing is that remember cells can also travel within blood vessels and lymph nodes as well, or lymphatic vessels. So often when you have a metastatic tumor that's invading the surrounding area, it can end up in lymphatic ducts and then implant in lymph nodes. So if this tumor starts to grow in these lymph nodes, what happens is that now you have a secondary growth in this lymph node. So a common site of secondary growths from breast cancer that has started to invade is feeling the axillary area. So not only in the breast exam is about feeling the actual mammary gland and breast tissue itself, but they might check the axillary lymph nodes to see, hey, has this actually gone past the breast and now into the lymphatics of the breast and into the axillary lymph nodes?